Good evening and welcome to Thai PBS World. Downward trend of new confirmed cases of infection of COVID-19. We can see in the recent days that the number has been declining a bit. So people must be wondering whether it's time to ease up stringent measures. In the Thai PBS World tonight, Khun Thepchai Yong and me talk to Dr. Thanarak Phalitpat, Deputy Director General of Department of Disease Control, whether it's the right timing to consider to ease up stringent measures.
You look a bit more cheerful than the previous week, so can we say that you see more light at the end of the tunnel?
The situation is getting better day by day, but to talk about the end at the moment, I think we probably talk about it too quickly.
Too soon?
Too soon.
Eh? So what does it mean? The fact that the number of new infections has been coming down steadily, it has to mean something, right? Something positive, of course.
Yes, of course. And I mean that the situation is getting better, as I mentioned earlier. And we hope that we have passed the peak, the first one. And we hope that we could maintain the situation or the transmission at very low level for quite some times. What I'm so afraid is that everybody's now learning the situation too, and they may start to probably relax a little bit. And as I mentioned earlier, it's not time for us to talk about relax yet. We should try to do our best still and hope that the situation will get even better in the coming days or weeks.
I see. So in your view, all these existing restrictions, the partial shutdown, the curfew should stay, right? At least for the next few weeks.
What I mean is that the control of the movement and also the social distancing measures should stay. We may relax some rules a little bit, but I mean overall we should try our best to stay social distance.
And what is the number that can make you feel relief or to say that this situation is quite okay and the rules can be more relaxed? Do you have the number in mind?
No, not exactly. But what I have in mind is what we should do in the next few days and few weeks. This disease, so far, we were able to detect a little bit more severe case by looking at the case fatality rates. You can see that our case fatality rates is a little bit higher when we compare to certain countries like China. What we would like to see is that we would like to capture more mild disease patient with mild disease. In this case, if we want to do that, our activity in testing and try to do the active case finding, contact tracing, and identify person we should be should be a little bit more rigorous than the current situation. So this is not just the number. It is also about what we do. If we try to find the disease everywhere and we can find it, then I will be more relaxed. But so far, I think we need to do a little bit more active in finding the mild case in that end. So to be able to really answer what is the situation in our countries.
More active testing for people with mild symptoms. Are you talking about any specific groups of people that we should focus on?
No, not exactly, because the disease itself may not be able to differentiate from other cold virus. So what I'm thinking about is trying to do the testing among certain situations. For example, if we saw the clustering of common cold, or what I would like to call corona-like virus symptoms, then I believe that we should do an extensive testing. Let me give an example. Let's say if we open up the department store and we start to find in certain department or in certain floor, there are a cluster of case of common cold, then probably, and if we detect, let's say, a few numbers, 2 or 3 cases in the same floor, we should probably do more testing in some of that area or in some of those clusters to see if there is any other cases as well. In that ways, we can understand the dynamic of the disease even more.
I see.
So far, we have done quite a good job on trying to do contact tracing, and now I think we should improve our strategy a little bit so that we learn the situation of the outbreaks. This is not news. We have done this in certain provinces already. For example, in Phuket, they identified the cluster of cases in certain areas like in Bangla, and instead of waiting for the case to come in to the hospital, they just went out and do extensive testing in that areas.
And what's the role of village health volunteers in which WHO has complimented that Thailand has done so well by having more than 1 million volunteers in local community? What's their role, and should we increase the number of them?
So far, I have to say that they have done quite an excellent job, very good job on helping the health personnel. The very first roles, if you remember, is that when a few weeks ago, when Bangkok announced the closure of so many establishments, and everybody from Bangkok, the workers, went back home. That is one of the very, very beginning of their roles. That is, they help other health personnel to identify who came back from Bangkok, and then helping set up the quarantine system to track them and to monitor their symptoms for 14 days. So far, I believe that they have done quite a great job, and now they are also helping in also doing the following up of the contact of the confirmed case as well. So not just doing those quarantine and monitor the health of those under quarantine, they also help with health education and trying to send a positive message, and also what people in Thailand should do under this situation. So they have so many roles to help us.
So for the benefit of our audience, can you explain to us a little bit more about the role of the health volunteers? Who are these people, and what kind of functions do they have on a day-to-day basis?
Usually they will help with before COVID, they work on several fronts. Like, for example, they identify the pregnant women in the village and encourage them to walk in and have antenatal care. They help us to do the lava survey to prevent dengue hemorrhagic fevers. So each year or each month, Ministry of Public Health will identify certain roles for our health volunteer to do. And then they went out to the village, and then they do their part. And then every month they will come back to what we call the health centers, or now we call health promotion hospital, to report back of what they have done in the past month, and also discuss about what is going on in the village, so that health personnel at the health promotion hospital know the situation and then can went in and fix the problem sooner.
I see. So you're saying that these people are very important connection between the health authorities and local communities, right?
Yes.
So it's not time to relax yet, but perhaps revising some strategies such as contact tracing in highly infected area. And that's all from Thai PBS World tonight.